For more on the fight against coronavirus in the United States, let's welcome Dr. Martin Blaser. He's Rutgers Center for Advanced Biotechnology and Medicine Director. Also, Dr. Celine Gounder, who is infectious disease expert and host of the Epidemic podcast. I want to thank you both for being here. You know, if you are somebody sitting at home trying to figure out what you should do right now, there are so many mixed messages coming across. I guess my question for you would be, what should Americans be doing right now, whether they're near one of these hot spots, whether they're not? People tell you, stay home, don't do these things, and yet for many of us, life kind of goes on as normal. Dr. Blaser, what do you think?
You know, we're in the early stages of an epidemic, and the key is to flatten out the epidemic so it's not too bad. We've got to do, social distancing works.
Meaning that you don't want too many cases at once so it doesn't overwhelm the hospital system.
That's part of it. And also, the longer you delay it, there will be some people who won't get infected, and maybe there'll be treatments, and maybe there'll be vaccine. So the key, delay works in our favor. So for individuals, they want to delay their exposures.
Dr. Gounder, we had a health official from New York City on earlier this morning, and it's the localities that are taking the lead on all of these issues. It's been very mixed responses. In New York City, you've got the National Guard that's come into New Rochelle. You've got schools there that are shut down. In Seattle, it's a different story. They're keeping the public schools open. What's the right answer?
Well, I am profoundly concerned about the lack of testing in New York City still. The volume of testing is still quite low. Seattle's actually been very proactive on this front. The University of Washington has scaled up testing. Along with the Gates Foundation, they're offering drive-through testing at one of their parking garages. Yeah. They're hoping to do home-based testing very soon. And the problem is, if you don't know what the number of cases is and where they are, it's very difficult to address a problem like this.
When you say testing, should it be to the point where anyone who has any sort of symptoms or is afraid they were exposed to it, should anyone be able to get a test at that point?
I think at the very least they need to be assessed and screened. And there's ways we can do this in tiered fashion. So there are other more common viruses we could start with testing for. And if those tests come back negative, so for example, the flu, if you test negative for the flu, then we can test for some other things. And if that's negative, then you can do a coronavirus test. But I think there needs to be a process for that.
More broadly speaking, we have had people come on and say, yeah, you shouldn't go to big public events. But by the way, Broadway's open, Madison Square Garden's open. You can go to sporting events. What should people be doing just in terms of thinking, should I be going to this work event? Should I be going to this school event? Should I let my kids play sports? What's okay and what's not?
You know, everybody has to assess their own risk. Some people are at more risk than others based on their pre-existing conditions and on their age. But I want to get back to testing. We're the greatest industrial country in the world. We could put out all the tests that we need so that people get tested often. If people know their status, then they can self-quarantine. We can control things if we can deploy enough tests.
What about the number of people who are asymptomatic or very low symptoms? I mean, should they be tested too to make sure that they're...
It's hard to capture. That's one of the reasons that this virus is so bad, is that it spreads from asymptomatic people. So that's very hard to capture. But if we can capture people who are symptomatic, so we can't stop it, but we can control it. And testing is a very important part of it.
But if the goal is to delay, and this is where it goes back to the Broadway theaters and stadiums and the like, why wouldn't the advice be straight up, you know what, for the next 2 weeks, cut it out?
Well, but then what happens on day 15?
This goes to your whole delay strategy, right? I mean, by default, if I buy you 2 weeks, I bought you 2 weeks.
Oh yeah, sure. So you could do that. It's just then.
And the question is, what's the economic damage of that? And then you have to.
How do you assess the risk reward when you're dealing with situations where you know people are going to die versus the economic
absolutely
crackdown? What do you tell people?
Well, I think you have to emphasize who's really at risk. So, again, it's people with chronic medical conditions, people who are older, especially in their 70s, 80s. Yeah, so, we do see an uptick over the age of 50, but really 70s, 80s and above is the highest risk. And who I'm really also concerned about is healthcare workers. If we see, this is the flattening the curve thing, right? So if you see a spike of people in one day, so say 30 people, 100 people come to the emergency room in one day. That's very different from 100 people over the course of a week. And when you have emergency rooms flooded with patients, it makes it harder for us to attend to all of the other issues. So if you come in with a heart attack, we're going to be slower taking care of you, and we're going to be sloppier with our own infection control if we're overwhelmed.
What do you think happens with when we read about the 35-year-old, the 40-year-old that doesn't have any underlying conditions? Do you think there's a genetic predisposition?
Very high dose.
Like the doctors in Wuhan.
Whereas somebody who gets it from the feared subway pole, maybe that dose is much less.
But the 120,000 globally and 3,600 deaths. So you would say that there are 90, 100,000 people that were mild symptoms that didn't need hospitalization?
Much more than that.
Much more than that don't even get hospitalized.
Yeah, it's a pyramid. It's a pyramid. The deaths are here. The cases are here. The mild infections are much, much bigger.
What do you think the numbers are really?
Could be 10 times.
Millions of people have been infected already around the world.
For sure.
Do you think
millions in China at least?
Millions?
Millions. But most of them have not been ill.
And then they actually are on the other side of it and probably won't be reinfected.
I guess that's my question.
I don't think you don't get reinfected.
Anybody who, in general, anybody who has an acute viral infection like this gets lifelong immunity to that.
Lifelong immunity.
My question, though, is China really on the other side of it? If they're putting people back to work?
Well, that's a great question. So we may well see an increase in cases again now that people are coming back to work, going back to school.
But the summer's coming, luckily. Maybe there's
It could be.
Maybe
if
sunlight.
This follows the same rules that the others have followed, but it may not.
So if we don't do, it's been highlighted that China does things that you can't even believe in terms of human rights and trying to stance this that we can't do here. So if we don't do quite as much, do you foresee our hospital system ever being completely maxed out to where people can't be admitted? Do you think that's still possible here?
Yeah, I'm concerned. So we have fewer doctors per person per population here than they do in Italy. We have fewer hospital beds.
There are plenty of lawyers
than they do in Italy.
We have fewer hospital beds and doctors per.
Yeah. So we have less capacity to absorb a big surge in cases. That's what I'm worried about.
Okay, what should we be doing right now? What would you direct federal or local authorities to be doing to handle that?
Well, I think we need to be preparing for that. And, some of that may be, just like they did in Wuhan, creating sort of makeshift facilities for that sort of thing. Now, I'm not advocating for those quarantine centers because I think those are actually somewhat problematic and may have fueled more transmission.
Right, if you get sent to a quarantine center, you're going to get a...
Yeah, so that I wouldn't advocate for. But, mobilizing people who maybe it's retired doctors and nurses, maybe it's people in the military, people who can step up and help.
Yeah, the center has to be in people's homes.
Yeah.
You've got to keep people at home as much as possible.
Which is why you got to test them and make them not come in to get
That's right, and bring the care to them.
Thank you.
Dr. Gounder, Dr. Blaser, thank you.